Hey, good morning. It's Patricia Murphy. It's Monday. This is Seattle Now. It's our second pandemic holiday season, and a speedy new variant, boosters, and rapid tests are all part of the mix. We'll check in with UW professor Ali Mokdad about how to stay ahead of Omicron. But first, some headlines. A month after falling ill with COVID, Republican State Senator Doug Erickson has died. Erickson tested positive last month while he was in El Salvador and was eventually medevaced to a Florida hospital. His family says he passed away on Friday, but didn't provide a cause of death. Erickson represented Whatcom County in the legislature for more than 2 decades and briefly worked for the Trump administration in 2017. The Whatcom County Council will choose someone to fill his seat. The state's new long-term care tax won't be kicking in next month like it was supposed to. Governor Inslee said Friday he's delaying the Washington Cares program so lawmakers can make some tweaks. The plan was criticized for all the people who would have paid in but not seen any benefits, like people who'd already be retiring before the plan started paying out, people who work in Washington but live in another state, and people who wind up moving and retiring somewhere else. Republicans are still critical of the idea and want it repealed entirely. There's also a push for a voter initiative that would make it an optional plan instead of mandatory. And no Seahawks game yesterday. They were supposed to play the Rams to see if they can keep their slim playoff hopes alive. But the Rams had almost 30 players on the COVID list, so the NFL pushed the game to tomorrow. They'll play at 4 p.m. COVID made the Kraken do some juggling, too. They postponed yesterday's home game after Toronto had an outbreak. Thursday's trip to Calgary is also off. It's the holidays, and the news that the Omicron variant of COVID will soon likely be the dominant strain circulating in the community is not good. But what it means in the battle against a virus that's taken more than 5 million lives worldwide is still mostly to be determined. Dr. Ali Mokdad is from the Institute of Health Metrics and Evaluation and is here with an update about what we know and what he thinks we can expect in the coming weeks. Dr. Mokdad, great to see you. Thanks so much for your time.
Thank you for having me.
UW says it looks like Omicron is 1 in 3 cases here. What does that mean in terms of transmission?
It's basically spreading so fast and taking over Delta. And the speed of spread has been really surprising for all of us. So if you look at the data coming from UW, we started at 3%, 6%, 13%, and now we are at 37% on the 12s. So it could be much higher by now.
Is that surprising to you?
It's really surprising because we have seen a lot of variants that have came about and they always are more likely to spread than the previous one. But this one is doing much more damage in a faster time period.
Let's talk about what we do know about Omicron. I have heard the illness is less severe, but really, what does that look like? What does that mean?
We know it's less severe in South Africa, but the population in South Africa is much younger than us, and people in South Africa, about 70%, in our estimates at IHME, 70% of them have been infected before. And now what we are seeing, for example, in Europe, it's rapidly increasing, but at the same time, we are noticing in the UK today, and a study came from Imperial College showing that it's not as less severe as what we have seen in South Africa. So we need to be very careful because the population age distribution is different, one, and also we have a higher immunization here, but we don't have as much infection in many parts of the Western community and here in the United States. I wouldn't take less severe for granted.
So what you're saying is that there are particularities in the U.S. population that could have impacts on the way the variant is hitting us.
Exactly. And remember, in the United States, 40% of Americans are not vaccinated yet. So we have only about 60% who are fully vaccinated, and very few, about 25% of those who are had a booster. And we know from a study in Germany that even after a booster, antibodies decline 2-3 months after that. So we may need another number 4 because the antibodies are not lasting for a longer time. The concern in the United States, as we're coming into holidays where mobility increasing, and we have a variant that's super spreader, and also our medical staff who have received the vaccines early on and have received the boosters early on. So we are heading into a time where we could see a rise in hospitalization in the United States and many hospitals, at the same time that we could lose some of our medical staff because they could be infected themselves and they have to stay at home. We need to be extra careful. Vaccines, boosters, and masks.
I'm glad you brought up vaccines because I want to talk about what we know about how well protected we are from Omicron. And I'd like to talk about people first who are considered fully vaccinated at this point versus someone who has also had that third shot, the booster.
So I've been on the record saying we should change the definition of fully vaccinated to be 3 shots, not 2 shots, 1. And I've been on the record saying that we need to cut the period between the second and the third dose to 3 months and not 6 months, which is very important for all of us, especially our medical staff. Boosters are very important. You please go and get your booster because we know right now the immunity, once you receive a booster, goes up by about 30 times more, and it's about 70 to 75% protection against symptomatic diseases. You need a booster, and you need it as soon as possible. And, of course, to wear a mask, quality mask, and wear it properly.
You back to the KN95, Dr. Mokdad?
Back to the KN95. Yes, definitely.
Yeah, we are too. You know, the advice I'm hearing from officials right now is pretty much the same stuff we've been talking about. Get vaccinated, get boosted, mask up, wash your hands, limit your exposure. But we are still not winning, Dr. Mokdad. And I wonder, are we doing enough? Should we be kicking up the restrictions even more again?
The playbook has not changed, yes. The preventive measures that we can take, including vaccination, are exactly the same for every variant out there. But we're not doing enough. We're not doing what it takes to control this, contain this virus and control its spread. But let's be realistic. The country is divided. Wearing a mask, getting a vaccine became a political statement. It shouldn't. And we're paying for it, 1. 2, we're paying for being individualistic, not thinking about our own community. For all of us to be safe, each one of us has to be safe, for the community to be safe. And unless you do your part, we're going to be weak, all of us. And unless we reach a high level of vaccination and we all pay attention to what we are doing, we are going to see more and more variants. We've been through this before. How many variants we have? Quite honestly, I have no interest of learning the Greek alphabet, so please help us.
You know, I read that vaccine mandates did help people get more vaccinations. I also noticed that Boeing rolled back its vaccine demand. Are we going far enough at this point? Do we need more?
We need more. Definitely we need more. And it's very hard for us in public health to say we need more and we need to push a little bit higher than what we have been doing before. If you look around you right now in the United States, I mean, the vaccine mandates, yes, they did help. And they will help even more if we keep at it. But you hear every now and then from businesses, and the last, 2 CEOs for the airlines saying you don't need a mask on a plane. I mean, that I've never heard of that. That's, in my opinion, it's irresponsible. And it's first, it's totally wrong and it's irresponsible. I mean, sitting next to somebody on a flight for 2 hours, waiting for a filter to suck his whatever he breathed out and then take it out and bring it back to me. I mean, this doesn't work. I've
changed train cars, Dr. Mokdad, for improper mask placement.
Yeah, I mean, we need to be realistic. And yes, we're not doing at the personal level, at the leadership level, we're not doing what it takes in some places. And we need to go back to the drawing board. Yes, mandates work and they will work with penalty. You know, my daughter is doing an internship in Oman. I took her during the pandemic to set her up. And in Oman, if you're not wearing a mask, there is a very heavy penalty. I mean, it really hurts not to wear a mask, but people are wearing a mask everywhere.
We're in a little bit of a wait and see period for the next couple of weeks. What are you watching for right now?
I'm keeping an eye on the severity of Omicron and how fast it's spreading here. But the most important part, I'm looking at our behaviors and how many people are going to get their booster. I'm looking at the percentage of people who are wearing a mask when they go outside their home. I'm looking at these behaviors, and I'm hoping for all of us here in the United States that we do the right thing and we be responsible and we protect each other.
Dr. Ali Mokdad is a professor of health metrics sciences at the Institute for Health Metrics and Evaluation, also Chief Strategy Officer for Population Health at UW. Dr. Mokdad, always good to talk to you. Thanks so much for your expertise.
Thank you for having me.
Thanks for listening. Jason Pagano produced today's show, which is also made by Jenny Cecil Moore, Diana Opong, Clare McGrane, and Caroline Chamberlain Gomez. Matt Jorgensen does our theme music. I'm Patricia Murphy.